Go ahead.
I will be speaking on a rare case of bilateral optic neuritis as presenting manifestation of lymph node tuberculosis. ये आगे नहीं जा रहा है. Sorry. A 23-year-old lady presented to us with history of sudden onset diminution of vision in the right eye since 4 days. The vision at presentation was PL denied in the right eye. There was no history of headache, vomiting or altered sensorium. There's no history of redness, pain or trauma. There was history of malaise for 15 days with progressively increasing painful swelling over the right neck. Other than that, she did not have any significant positive history. There was past history of neck swelling in the right side, which had subsided with oral medication 4 years back. For 1 week, she has taken the medication. And there's also family history of tuberculosis in the husband, who was on ATT 1 year back. She is married and has two children, 7-month-old twins. There was no high-risk sexual behavior or any other history. There was no any addictions or any history of consumption of toxic substances. On examination, the patient was thin-built, afebrile. There was pallor, and cervical lymphadenopathy was positive. There were no positive systemic findings on examination, including the nervous and respiratory system. However, on local examination, we saw that there was a 5 centimeter into 5 centimeter mobile nodular swelling over the submandibular region with mild tenderness. So the visual acuity was PL negative with PR inaccurate in the right eye. The left eye had 6/12 to 6/9 vision with pinhole. Other than that, everything was normal except for RAPD in the right eye. And on the fundus photograph, there were disc margins were blurred and raised with tortuous vessels. In the left eye, there was a splinter hemorrhage also. So this is the photograph we took with 20D. This is the picture of the left eye. You can see the disc margins blurred with splinter hemorrhages. So the differential diagnosis which we made was papilledema or bilateral optic neuritis. So on investigating her further, since the chest x-ray and everything was normal, we went ahead with the FNAC of the submandibular lymph node. It came positive for tubercular lymphadenitis. So since the patient was young and feeding and like she had 2 babies and PL denied, so we started her on injection methylprednisolone 1 gram IV infusion over 30 minutes for 3 days, followed by oral prednisolone. She was also given tablet levofloxacin, and after FNAC report, we started her on ATT. So the visual acuity was not improving, but she was PL positive at the end of day 3. So this is the fundus picture showing day 3. You can see the disc edema has resolved dramatically. At the end of 2 weeks, she came back and her vision had improved to 6/9 in the right eye. The left eye remained 6/9. And as you can see, there was no RAPD present in the right eye. So my take-home message is that initially what we were thinking is that if the patient is PL denied, we should not do anything like that. So in this case, I saw that a PL denied patient can regain near normal vision. So that's why I presented this. And optic neuropathy in TB, in our case, probably we thought that it is because of tubercular perineuritis and has varied manifestations. Bilateral optic neuritis has not been described. Bilateral optic atrophy has been described. So this is these are some of the references which I saw. So in this, they have described that papillitis is the major cause of optic neuropathy, followed by neuroretinitis and some cases optic nerve tubercle. So my only point which I want to stress is that visual recovery from tuberculous optic neuropathy is common, and if the diagnosis, you can clinch the diagnosis and give the treatment immediately. This is my personal thing, that they gain vision fully. Thank you, ma'am.
So yeah, nice.
The thing is that when you are dealing with actually tuberculosis, and yes, they come with a lot of varied spectrums of ocular manifestations. Yes, so clutching on that, you didn't have anything except this optic disc edemas in both the eyes. That is what there was a RAPD in both the cases. And you are saying that starting immediately with ATT.
No. We first started her on steroids because the patient was PL negative. So
Okay.
we started on steroids and
Without
then
doing ATT testing also.
ATT's testing was sent. So at the end of third day, the report came positive. Then ATT was started.
Okay.
So before that, we have already started steroid, thinking that we have nothing to lose.
Yeah, but in tuberculosis, you have to be very careful to do other tests because we just cannot give on ATT in all cases when you see a bilateral disc edema, even though the vision is lost.
Ma'am,
when you are already suspecting that this case can be a tuberculosis, if it is a pulmonary tuberculosis.
Ma'am, it was not pulmonary.
Okay.
Cervical lymphadenopathy was there, and FNAC had.
So did you do a chest X-ray
Yes,
and then
ma'am, yes, ma'am.
CT and all this?
Yes,
So
ma'am.
there was
MRI was also normal actually.
so that is why it is like
Yes, yes,
you are
ma'am.
having it
Yeah.
can be a atypical presentation, but has to be very careful because if the patient has a pulmonary TB and you just start on there
No,
can
ma'am, we have
yeah.
taken reference from medicine people. They have
Okay,
seen and
okay.
then with their cooperation.
Okay, so
and
you are
everything,
following
yes.
it this,
Yes.
but can you say that it was only your pulse therapy which helped, or giving them the ATT, and there has to be some
Yes, ma'am.
pulmonary thing going on because extra pulmonary only did it help it to gain
Ma'am,
its vision
I-
back when he is having only PL negative? This is one point I just
Ma'am,
want to stress.
ATT will take some time to work.
Yeah.
So by the end of third day, जब हमने ATT शुरू किया, उसके पहले उसका PL positive हो गया. She could see some kala things and all. So that's what she was telling. So that's why I thought.
No, it's okay. So how, like giving your pulse therapy, she regained back immediately?
Not immediately,
Yeah.
ma'am. It
So
took
you-
time. It
so
took
how
her
long
2
did it
weeks.
take?
2 weeks.
2
She
weeks.
came to us
and that
after 2
time
weeks.
you had started your ATT also.
Yes, ma'am. She was under ATT.
Okay.
You mentioned about the disc finding of the left eye, right?
Yes,
eye you
ma'am.
didn't show.
Right, I also have shown, ma'am.
Shown. Okay, fine.
I've
Maybe
shown,
I
ma'am.
might.
Thank you,
Okay, nice presentation.
Thank you, ma'am.